Everything you need to know about nicotine. Nicotine is a nitrogen-containing molecule produced by a variety of plants, notably the tobacco plant. It is also manufactured synthetically. Nicotiana tabacum, the Nightshade family's nicotine, is present in tobacco plants. Nightshade vegetables include red peppers, eggplant, tomatoes, and potatoes. While nicotine is not carcinogenic or particularly hazardous on its own, it is highly addictive and exposes people to the extremely harmful effects of tobacco addiction. In the United States, smoking is the leading preventable cause of death. The effects. Nicotine has a variety of physiological impacts. Nicotine is a sedative as well as a stimulant. When a person is exposed to nicotine, he or she feels a kick. This is due in part to nicotine stimulating the adrenal glands, resulting in the release of adrenaline. This adrenaline rush boosts the body. There is an instantaneous increase in heart rate, respiratory activity, and blood pressure, as well as an increase in glucose release. Nicotine also causes the pancreas to generate less insulin, resulting in a modest rise in blood sugar or glucose levels. Nicotine indirectly promotes dopamine release in the pleasure and motivation centers of the brain. When people use heroin or cocaine, they experience a similar impact. A delightful sensation is felt by the drug user. Dopamine is a brain neurotransmitter that influences emotions, movements, and pleasure and pain feelings. The feeling of contentment increases as dopamine levels in the brain rise. Nicotine can function as a sedative depending on the dose ingested and the individual's nervous system arousal. Pharmacologic effects. Nicotine raises the heart rate, heart muscle oxygen consumption rate, and heart stroke volume in humans, mammals, and most other species of animals. These are referred to as pharmacologic effects. Psychodynamic effects. Nicotine consumption has also been related to increased alertness, exhilaration, and a sense of relaxation. Memory and concentration. According to research, nicotine appears to boost memory and focus. This is hypothesized to be caused by an increase in acetylcholine and norepinephrine. Norepinephrine also heightens the experience of arousal, or wakefulness. Anxiety reduction. Nicotine causes a rise in beta-endorphin levels, which decreases anxiety. Nicotine is extremely addicting. People who habitually ingest nicotine and then abruptly cease may experience withdrawal symptoms such as cravings, a sense of emptiness, anxiety, depression and moodiness, irritability, difficulty focusing or paying attention. Adverse consequences. In most organs and systems, nicotine has a wide spectrum of adverse effects. Blood circulation can be influenced in the following ways. A higher clotting tendency, which increases the danger of damaging blood clots. Atherosclerosis, which occurs when plaque accumulates on the arterial wall. Aortic enlargement. The following are some of the brain's side effects: lightheadedness and dizziness, erratic and disrupted sleep, nightmares and horrible dreams, potential blood restriction. Nicotine can have the following impacts on the gastrointestinal system: dry mouth, also known as xerostomia, nausea and vomiting, peptic ulcers, diarrhoea, and heartburn. Following nicotine ingestion, the heart may suffer the following symptoms: alterations in heart rate and rhythm, an increase in blood pressure, constrictions in coronary artery disease, and increased risk of stroke.